All right, to start, we're going to talk about the difference between obstructive and restrictive lung disease. So what I'm drawing here are obviously the bronchioles and the alveoli. Lungs, right? I'll branch out down here. So before, well, I guess I probably could have started with this already all drawn out, right? But we're going to first start talking about obstruction. So you'll see obstruction if there's anything along the path of the airway that can get in the way of air moving through the passageway. So this may be stricture of the bronchi due to chronic bronchitis that you might see in COPD. This could be air trapping in the alveoli that you see in emphysema. This could be inflammation having to do with hypersensitivity in asthmatic patients, things of this nature. Anything that stops the flow of air moving either in or out is considered an obstructive lung disease. Conversely, if we talk about restrictive lung diseases, we're referring more to things that put pressure on organs or different tissues that keep the lungs from opening or closing to their full capacity. So one such might be the diaphragm, right? The diaphragm, a very large muscle posterior to the lungs. This muscle is largely responsible for our ability to move air in and out of our lungs, right? And if we have any kind of musculoskeletal disorders where this muscle is impaired, one such might be amyotrophic lateral sclerosis, multiple sclerosis can do this, any sort of nervous system damage which affects these or any other accessory muscles which help in this ability to expand in air, that would be a restrictive lung disease. Also, damage to the lung walls that comes with either long-term exposure to chemicals like such as asbestos, or it could be something as autoimmune disease which could result in sarcoidosis, or damage to the walls of the lungs which keep the lungs from expanding. Even morbid obesity, which puts excessive tissue and different adipose tissues around the lungs, keeps the lungs from expanding completely. This would also be considered a restrictive lung disease. So there you go. The difference would be obstructive has to do with the airway being impeded. Restrictive has to do with structures keeping from being able to open to their full potential or move air through their full potential.